Welcome back to Born for This. I'm Dr. Johanna, a holistic doctor, a mother, and someone who once believed firmly in my ability to protect my family from needing medical intervention.
And I'm Peter. Before Silas was born, we had a clear vision of our family's health. Holistic, natural, safe. But life had different plans.
In today's episode, we are sharing honestly about what we believed before our son's diagnosis, the conflict we felt stepping into the medical world, and how our hearts and minds shifted in a way we never expected. So I think a good place to start is talking about probably both your perspective on holistic health and mine before Silas was born. I mean, we both have been in this holistic world for a long time. For myself, since I was a teenager, we had made some shifts in our family dynamic when I was younger on how to live a healthier lifestyle. It started out with food. Then I got introduced to chiropractic, which is how I actually got into becoming a chiropractor, is because it helped me with my asthma. So it helped me get off of asthma medications that I was on all through my childhood. So for me, that was so life-changing. I didn't understand how that happened, but it was something that I wanted to help people with and be able to serve them in that regard. We also made a holistic shift because in my past, we unfortunately did lose my brother at a very young age of 7. He was pretty sick at the time, and we kept taking him to the pediatrician, and they kept sending us home back and forth. And one night he passed away in his sleep. So for me, that was a big life-shifting moment of not that I didn't trust the medical side, because I think there is a time and a place for medicine and procedures, and that's part of our journey as well. But it shifted my mind perception on, is there any way we can help change and improve our health and be more preventative from that mindset, even at such a young age. So from there on out, we pretty much have been living more of like a holistic lifestyle. Obviously, I became a chiropractor, and the whole philosophy of chiropractic is that your body is made to heal from the inside out. And we just help stimulate that nervous system to help to promote that to the best of our ability. But of course, the foods we put into our body and the chemicals we put into our body have an effect as well. And we just live a holistic lifestyle. We eat healthy food for the most part. I mean, nobody is perfect. We exercise, we move our bodies, we get outside. So for the most part too, like overall our family is relatively healthy and don't really have much going on. So that's just how it is. How did you get into this world?
I was born into it. Yeah, no pun intended. But I grew up in a chiropractic family. My dad, my uncle, my sister, they're all chiropractors. So naturally it was a good fit when I met Johanna, because I was already interested in living a healthier lifestyle. I was brought up not taking any over-the-counter medication just for every time I had a cold or a sickness. It was just something you dealt with and ate healthy and drank a lot of water and got through. And so it was a pretty easy combination for us to work together on life in general, but also when we dealt with this scenario in life, it just kind of, we had the same beliefs, so it made things easier to work with.
Yeah. So I would say overall, like the way that we practice and live our lives is just that we just support our bodies in the best way that we can. We fuel it with good, healthy food. We allow for movement to happen in our bodies and our kids' bodies. We stay as active as possible. And of course, every once in a while, we do obviously get immune system upgrades. We get sick and that kind of stuff, but we just support our bodies through that. And when there is a big intervention that needs to happen with like medical intervention, like obviously we weigh our pros and cons and decide if we want to move forward or not. So there is a time and a place for that stuff. But thankfully, because of the choices we make each and every day, we really can use that at a very minimal amounts. So, I mean, obviously it has a massive impact on our personal and my professional life, because that's what I've been doing for the past 14 years, is helping people thrive through corrective chiropractic care. And we do see lots of kiddos as well. So we've been able to help them have better rest, better sleep, better regulation, amongst other things. And it's been really, really good. And up until our story, like, we just rode that wave because we didn't need any knee friend intervention, and it was great. Obviously, our beliefs got shaken to the core.
Yeah. I was going to say that obviously things changed when our youngest son was born and we had to make some decisions. We definitely had parts of us that didn't want to have to make the decision at all. We definitely had moments where we thought we didn't want to do anything and we didn't want to intervene. This was the way he was born, and we felt like he was perfect the way he was born, and maybe we needed to just let nature take its course and teach him how to live and cope with things the way they were and the way he was given them.
Yeah, for sure. I think for me, like the big point that things had switched and my brain was challenged that we were going to have to lean on the medical side, which did make me uncomfortable in those first moments because that's something we had never anticipated doing. Like Silas was a home birth and we had a midwife there and two midwives there and a doula, and everything was great and awesome. But then that moment we realized he was born with his birth defect, then my brain started spiraling on how were we going to navigate this medical space, because I wanted to find an answer that there was something non-medical based that we could do to help him. Like you said, we definitely toyed around with, okay, maybe he was born this way, so maybe we just leave him like that, and we'll navigate what that will look like for him as he grows and gets older. But obviously, like as you'll find out in later episodes, like the mental load to that, we tried to take that burden off of him and put that on ourselves so he wouldn't ever have to know technically what it would feel like to be very different in that regard. So doing the research on what Silas had and how that was actually corrected and fixed, the only solution we had was to rely on the medical providers and the medical side. But that first interaction we had with a specialist was exactly what I had anticipated and why I didn't want to be there. And it was very challenging to even decide to move forward to find a provider that best suited us and our values and our core beliefs. And how do we marry those two worlds? But I am glad that we did, because the outcome is great for him. But it was not easy. And I think part of the bigger mission and part of the goal of like speaking out about these things is to empower caregivers and parents that just because you go to one professional and get one opinion does not mean that has to be your only stop, especially if there's something inside of you that is screaming like, no way, keep going, look for somebody else. So that was definitely part of our experience. And I definitely felt obviously misunderstood by the medical side when we first went into that first appointment, because I was actually told not to cry, and I'll never forget that. So
Yeah, that was a rough one. I think that we were pretty challenged with all of this because even when we did find the right doctors and the right centers to go to, there was nothing holistic about it. There was nothing that could make us feel like we were staying true to what we always lived. We had to break out and go more medically based than we ever thought we were going to have to. Um, and that was one of the most challenging parts, is just admitting that to ourselves. There was no holistic healing path that we could take and get the result that we felt would give him a normal life. So that was a big painful moment when we realized we were looking at a surgery, if not more, and there was no escaping it. If we wanted to give him what we felt he needed to have, is a normal functioning body, fully the way it should be. And with the comments about helping our son heal as holistically as possible, why don't you tell everyone about some of the decisions that you were able to make, to help stick to our roots with the holistic aspect of our lives, and just talk about, there were a lot of small decisions and even larger decisions that especially you had made to help support him through this process. Can you just speak on that a little bit?
for sure. So some of the smaller things that we decided to do was, of course, support and boost his immune system, and we did that through different supplementation. And that was important because if Silas had gotten sick within like a 2-week time frame of the surgery date, we would have had to reschedule. And so obviously like we have busy lives, but also like his health was most important in the health of like the medical staff that are doing these procedures. So we definitely just like focused on supporting his immune system the best that we could naturally, by doing just like a good multivitamin, a good probiotic, some vitamin D, zinc, that kind of stuff. On like a little bit of like a next tier we did is we supported basically his drainage pathways. So I knew that there had been, I know that like ultimately the giving a young child like anesthesia is quote unquote safe, and you have to weigh the risk versus the reward in that regard. But of course, there was like things I was reading that it could ultimately affect brain development, especially when they're so young, which was a huge concern of ours because he was going to be under anesthesia 3 times, all by 18 months of age. So one way that we felt more comfortable inside that space and navigating it is doing different types of just like little tinctures, some homeopathic things that help just open up his drainage pathways, meaning like it would just make sure that like as his body was coming off the anesthesia, it was properly detoxing it out of the system versus just getting congested and all jammed up. And so there's some really good ones out there that help reduce histamine, help to support healthy body, that kind of stuff. And that worked really well for us. And then on another part of it is, of course, post-op, he had to be on technically Tylenol and Motrin rotation. So I am very thankful for this day and age where you can get Genexa, which is an acetaminophen. So it's like a Tylenol replacement. It has the same main like drug in it. However, it doesn't have the dyes and sugars and different things. So it's very effective in pain reduction and like fever reduction, but it doesn't have all the other like just preservatives in there. So we were able to use that. And we had to do our best with the Motrin. They don't have they don't have another Motrin that doesn't have all that stuff in there. The best we could do is like a dye-free version. So we just had to do that. I do remember though, as we were going through this process the first time, there was a shortage in these things.
Forgot about that.
And we had to drive all over St. Pete to find them, which is just ludicrous because we had never used these things before. Like they weren't in our house, like we didn't use them. And the sheer fact that like we needed to, but people were literally hoarding it for whatever reason.
Well, it was COVID times. I don't know if it had anything to do with that.
Yeah, I'm sure it did. So anyway, people were hoarding it and like legitimately driving to every store trying to find at least a bottle or two, or asking my network, hey, does anyone have any of this stuff? Because like we legitimately need it for our son's post-op recovery. So that wasn't super fun, but we
Not thinking about that in a long
we
time.
did get it. And actually, I do actually remember this is one good thing about the surgical center that we used is we were able to have just like a touch call with them. And I had mentioned this, and for some reason, it wasn't an issue in Texas where we were going. It just seemed to be at least a Florida thing. So we were able to get what we needed, but we were using cleaner versions of that stuff so that we were just like, as his body was repairing and recovering, we were trying to keep his body as clean as possible. So that way he could just properly heal, right? We wanted to give him the best like space of like his body being in homeostasis, like, which is like where your body wants to be. One of the biggest things that we did is hyperbaric oxygen therapy. And I will say that we did do the soft shell chamber. So if anyone knows anything about hyperbaric oxygen, there's like different chambers. There's hard shell and there's soft shell. Hard shell is definitely like when there is compromised wound healing is like the best one to do. However, in our area, the closest location to do that, even though we're in a very populated area, was at least a 35-minute drive minimum one way. And you would do these sessions for 90 minutes at a time, up to 120, because it takes time to build up the pressure for you to stay in the chamber and then build down the pressure. And then you'd have to drive 35 minutes back. Silas and I made it one time, and we didn't even make it through the whole entire session because, unfortunately, this is also my frustration and why you have to weigh your pros and cons is when we went in and we did the consult with the doctor to make sure it was okay for him and I to get in the chamber because he was young. He was 6 months old, so I had to go in there with him. He did have sinus congestion, and the main doctor said it was fine. And we didn't even make it to pressure because he was in so much pain. So I tapped out, we pulled him out, and I sat inside that space of like, how are we going to make this happen? I will do anything for him, but how will we make this happen? And so
5 days a week.
5 days a week. Yep. And so I did some more research, and because the clinic, the hypospadias clinic that we went to and did our surgeries did recommend hyperbaric oxygen, the hard chamber. But I did some research on would the soft chamber be effective in wound healing? And the research shows yes. Is it going to be as effective as the hard shell? No. But in our case, we were not dealing with them telling us we had to absolutely do it. There were no issues with wound healing at the time. So it was just like something I felt like we could do to just, again, prep his body for pre-op and post-op. So we did make the decision to purchase a soft shell hyperbaric oxygen chamber. So that way we could do those sessions inside of our home. And because we were able to do that, we were able to do a recommended amount of sessions before his surgery for surgeries 2 and 3. And then on the other side, we were able to do an amount post-op to help promote proper healing. So that was like one of the best things. I also do like wholeheartedly feel like that is one thing that kept Silas and I's immune system like super strong through this process. Cause there were a couple of times that you and Dakota still got sick, but like Silas and I did not. And the soft shell chambers are they still deliver higher levels of oxygen to your body under pressure. So you're able to like really absorb it more and get more out of it. And so like the research shows that benefits of that are just going to be like better healing. It helps boost your immune system. It will help you recover and repair. And it can help with all kinds of things just besides wound healing. It can help with joint pain and pain all over. And anyway, so it was a really good thing for us to do. I would love to talk more on that because I felt like that was like one of the most essential things that we did in his healing process. Some of the other stuff that we like had basically like peppered in there was like red light therapy, because there are like red light devices out there that you can use to reduce inflammation, to promote proper healing. One of the things that you guys will hear later in a different episode is that like with what Silas had, because it was so many surgeries and his case was severe, the surgery was like twofold. It was a functional surgery to fix something that wasn't properly developed and working 100%, but it also was a reconstructive, like cosmetic surgery, because we also needed things to look, or wanted things to look normal and right. So I do know that cosmetic surgeons promote red light therapy to help their patients heal and their skin heal and repair and recover. So that also is something that was really great and easy to use and to do. And yeah, that was like majority of what we were doing for that. And it did make a difference. We didn't do all of those things the first time around. We were just still in such like sheer shock mode, I think, with the first surgery, not knowing what to expect. Any of that stuff. And we, in each time, did get a little bit easier in regards of like understanding what we were walking into pre-op, post-op, and all of that stuff. So, so as all of this evolved, right? And that's what we hope to provide and like help families that are now in the very beginning not have to like pepper this stuff in along the way, but they can do it from the very beginning. So yeah, that was good. It was really good for us. And it married our two worlds back together with the medical side and the holistic side, and made us feel a bit more empowered in his ability to heal and recover and repair. And I'm glad that we did do all that stuff. And I do just want to like highlight, like, why are we talking about this? Because not everyone's going to resonate with this episode in particular, because some people obviously like live their life inside the medical system and that's what they wholeheartedly believe. And that's great. And we are totally here to support parents, caregivers, the kiddos going through this on wherever you fall on that spectrum. Like, it really is our like life mission that we are not here to place judgment and tell you it has to be one way or another. We really want everyone to feel accepted inside this space. But I do know that, especially with what Silas had and going through this in the Facebook groups in particular, it was very black and white, of like very medical. And then when you found someone that was more on the side of like what we were on the holistic side, it was very much like, you don't operate, you don't do this, you don't put your children through anesthesia, you don't. And that's hard, because then you have that internal conflict and dialogue of like, am I doing the right thing? All these other wellness individuals are saying, no, don't do that. But as a parent and as the caregiver in this scenario, that that didn't also feel right and sit right. So I think it's just important to shed light on the fact that there are individuals out there, no matter if people agree or not, that live a holistic lifestyle and only use certain like medical practices and when they're absolutely necessary. And of course, everyone's thought of like what is necessary is different, and we're here to support that no matter what. So again, there's no judgment, but this is just our story and how we got into this and how we actually help support Silas through his journey with doing some other holistic approaches, because it empowered us to take back some control in his healing journey. And unfortunately, not every medical provider is going to tell you that you can do these different therapies, but you can. And of course, always check with them, right? This is not medical advice. Check with them and make sure that you and your team feel good about it, which is what we did. But there are options out there as well. So if you do feel like you have no option but to lean on like a medical professional for this stuff, there are still support outside of those four walls that you can do to still feel validated in the holistic life that you live.
Right. Yeah, I think that the balance is what we needed to find, and we did find that not in the surgeries themselves, but in the
Good.
healing process.
Yep.
So we have plenty to talk about how we supported him the best that we could when going through the healing process. There was a lot of things that we wanted to do, some we could, some we could not. Um, there were different medication choices that we made or thought about making to help him through pain and through the healing process, um, all the way down to supplements and how we handled him after all the surgeries.
Yeah, I think the best place that allowed for us to find balance between the holistic and conventional medical practices was our ability, and thankfully the background that I had in the holistic world and practicing it each and every day and feeling very educated in the ability to know like what we could do to support him outside of that surgical center, because inside the center that wasn't happening, which is okay, right? That wasn't expected. So we brought it outside of the center when we got him home. How do we implement these different protocols to make sure he was healing at the best of his ability? And they did make a difference. I will say that, because we didn't do that kind of stuff after surgery 1, but we did after 2 and 3. So that was really, really a good place for us to start to navigate and work around as far as that went. And yeah. I mean, it was a mindset shift, because it wasn't black and white anymore. It was more gray. And I think that's what this whole mission is about, is accepting that gray space and providing that gray space and supporting wherever the caregivers fall on that spectrum.
Yeah, you can let yourself go down pretty bad paths if you focus on losing control rather than maintaining control where you can. Um, and that's sort of how we felt, that we were losing control with the surgeries, but we knew we could keep control with some of the smaller decisions that we were making throughout the healing process. Um, and we just held on to that because we didn't have a choice. We did have a choice, but we did not want to make the choice of doing nothing. So we held strong in we're going to support him in the holistic ways that we were living to the best of our abilities. And I think that we can honestly say that we wouldn't go back and change anything that we did throughout the whole process, which is always a good feeling, and something that we're thankful for.
Yeah, absolutely. Yeah. So hopefully that resonated with some of you holistic caregivers out there. We definitely want to continue to just share more on that story, and we will do some information like what did we do to actually support him, because that stuff is so important, and we can talk about that in a different episode. If you are struggling to reconcile holistic beliefs with medical realities, know this: you are not alone. And it's okay to exist somewhere in between. Healing isn't linear, and neither is our understanding of health.
Trust yourself to find the path that feels right for your family. Keep questioning, keep learning, and know that choosing both worlds doesn't mean compromising who you are. It means growing.
Remember, you were born for this.
If today's episode resonated, please subscribe, leave a review, and share your journey with us at bornforthisstories.com. We'd love to hear how you're navigating your path.
See you next time.